Loneliness is our body's social hunger, an evolutionary alarm meant to drive us back to the tribe. But in a hyperconnected world, the alarm keeps ringing and there's nowhere to go. The U.S. Surgeon General has declared loneliness a public health crisis, a silent affliction with devastatingly loud consequences. Last winter, an 82-year-old man named Harold was rushed to the ER, not for illness but for loneliness. He'd called 911 just to hear another human voice. And he's not alone. We're living in the most connected era in history, but rates of loneliness are skyrocketing. We talk to AI more than our neighbors. We like more, but feel less. We are hyperconnected, yet emotionally starving. We have more friends than ever, but fewer confidantes. Loneliness isn't just about being alone. It's about being unseen in a world full of eyes. What if loneliness isn't just a side effect of modern life, but the logical outcome of how our digital systems are designed? We're living through the most connected era in human history, and yet people feel more isolated than ever. The danger isn't that AI will replace human connection, it's that we'll forget how to do it ourselves. A nurse in rural North Carolina started hosting quiet rounds, 5 minutes per patient, no chart, no screen, just conversation. Within a month, patient satisfaction rose 40%. One of them said, "I didn't need another pill. I needed to feel remembered." Text a friend, smile at a stranger, invite someone over. One moment of real connection can reset your entire nervous system. It is the foundation upon which a meaningful life is built. This medicine of togetherness is something we can all help to create, for ourselves and for each other, in one small, courageous act of connection at a time. Loneliness may be contagious, but so is connection.